I cannot get any health insurance through the state, any medical card or anything. I've tried to get other health insurance, but it's too expensive. It's like $400 a month just for me. And when I have tried to get Medicaid for myself, they say I make too much money for myself. I can get it for the kids, but I can't get any insurance for myself.
And how much do you make?
Usually make about $1,500 a month.
Which is how much a year?
I believe when on my taxes I claim $13,000, a little over $13,000 for the year.
So what is the cutoff point? So at $13,000 a year, you make too much money.
Yes, at $13,000 a year, I make too much money for myself to get any insurance to the state.
Do you ever think about what you would do or what life would be like if you did not have that coverage? And what are the thoughts that go through your mind?
Oh, if we did not have health insurance for the kids, I don't know what I would do. There's no way I could, even take them to the dentist or to the eye doctor. My daughter, 2 of my kids wear glasses, and, just for an eye exam, at least $60, and then the glasses, and there's no way I could do it.
Have you ever thought of looking for a job that would offer medical benefits?
I have thought of trying to get another job. At one time I did have a part-time job, and they offered health insurance, but it was $300 a month, and I just can't afford $300 a month. I believe I could use that $300 a month for bills that I'm using every day instead of for an insurance that I hardly use or that I only use in emergency, which when you need it. But to me, in the long run, $300 a month comes in more handy.
Now, have you ever tried to look into the cost of just getting private health insurance?
I did. I got online. I tried to get a certain insurance, and I filled out all the paperwork. And they asked you, like, when the last time you had went to the doctor and for what reason. And I told them, it was for a sinus infection. And they said, with my sinus history, that I would have to pay $400 a month for insurance. So I didn't get it.
Would there be any kind of like an amount that you think you could afford to get yourself health insurance? Is this something that you could afford at all?
At this point in time, I don't think I can afford health insurance for myself.
Now, I would think that's got to be a little bit scary. If you get sick.
Yes, it has, because when I have gotten sick, I don't go to the doctor, or, I try to find clinics that do it based on your income. I wish I could go to the doctor more. I wish I could see a specialist for my sinuses, but they don't cover that there.
Right now, you were saying you didn't feel well today, so what have you done about that?
I have went and got some medicine, for over-the-counter medicine, and I've been taking that, and it seems to be working right now. So.
Now, what are those costs, these when you buy products like that? How much does that weigh into your budget?
It gets expensive, because I tried, before I knew about the clinic, I would just try to go over the counter. But it adds up. The box I bought yesterday was $20 for, I think, 20 pills, 24 pills. So it adds up, the more you use it.
So at one point, you did have a bit of an emergency. You had to have gallbladder surgery. Tell me about that.
When I realized I needed to have gallbladder surgery, I had just had my daughter, and so that was 10 years ago. And at that time, I did have the health insurance, but by the time they scheduled the surgery, my health insurance had expired, because you get the medical card through the state for 2 months after you have your child. And so when they scheduled it, I did not have health insurance. And so I put it off. I didn't have it then because I already didn't have insurance until I absolutely had to have it, and it was very expensive. It was about $15,000, I believe. I'm not quite sure on the amount.
How did you pay for that?
I didn't pay it for a long time, until when I was trying to get a house, I had to clean up my credit, and I would make payment. I just called all the collections and, set up payment arrangements. Or when I got my income tax, I would call and say, okay, I have this much money, how much will you take? And a lot of them would cut it in half, or stuff like that. But it took me about 4 years to get it paid off, everything paid off.
Does that weigh on your mind if he would end up in another predicament like that?
I worry about that a lot. Like if I got sick and had to have surgery again, you know, that's a lot of money that you got to come up with. And even if it's $50 a month, I mean, and when you have surgery, it's not just one bill. You have the, you know, anesthesia and this, the doctor, all these bills. And even if it's $50 a month, it, you know, they want $50 for each one. So it adds up. I just really think companies are out to make their money, and they're gonna, I mean, if you have health insurance, if you're good, you know, make enough money to afford it, you can get it. If you don't, then you're kind of just out there. I would like the president just to be able to make insurance affordable for everybody. I mean, that's the main thing for me.
What would be affordable for you?
I don't know. I mean, if I had to pay, you know, $50 to $100, I think I could, you know, work that in there some way. But I mean, I can't afford $200, $300 a month for health insurance for me. And then you have to turn around and have a deductible on, you know, on top of it. And not having any health insurance affects my going to the doctor. You know, if I don't have any way to cover it, then I just don't go unless I really have to go.